Hi guys, Dr. Berg here. In this video, I want to share with you some unique insights in preventing diabetes. Now, in most of the videos that I have, I talk about insulin resistance and how to get on a ketogenic diet, how to do intermittent fasting to help you with this condition. But I want to give you some more understanding of the effects of insulin resistance and what precedes that, okay? The first thing you need to know is insulin resistance is really a defense mechanism of the body. It's a protective mechanism against the toxic effect of sugar. That's what it is. What happens, your body develops resistance against insulin to stop the sugar from going in the cell because too much sugar is really bad for the cells. So one of the problems with insulin resistance is the body will make a lot more insulin to try to create the effect. So we have this protective mechanism, and if you don't change your ways, your body just makes more insulin to drive it through to make it connect because it's trying to lower the sugar. So eventually become a diabetic type 2, and your sugar starts going higher and higher. So you have a combination of all this sugar in the blood and all this insulin. It's not a good picture. So there's 4 main cells that are affected by sugar. One is the arteries. The endothelial layer of tissue is affected by high levels of sugar. Then the retina in the eye, the capillaries are affected. Then we have the kidney cells, specifically the mesangial cells. Then we have the nerve cells, the peripheral cells on your fingertips and your toes and your bottom of your feet. So that's why in advanced stages of diabetes, you have loss of vision, you go blind, blood clots, that's heart attacks and strokes. You have a lot of people on dialysis, so that you lose the kidney function. You have severe burning and pain on the bottom of the feet and tingling and loss of sensation in the fingers as well, and gangrene, so you lose your toes and the foot. And that is because these 4 types of cells, or parts of the body, do not regulate sugar like other cells. Other cells of the body can balance and release sugar. These 4 cells cannot. So the sugar builds up and creates massive destruction. Now, in order for you to get insulin resistance, something precedes it, and that's mitochondrial damage. So in the mitochondria, you also have something that helps prevent the excess waste buildup from the altered pathways, okay? So this is a new word I'm going to give you. It's called transketolase activators, okay? You don't need to know that. All you need to know, there's something in the mitochondria that helps decrease the waste from the damaged pathways. So it prevents this buildup of this toxic waste that causes destruction right here. Now there's 2 main nutrients that can greatly reduce the damage to the mitochondria. Number 1 is B1, okay? B1 can reduce the damage by 25%. But there's a type of B1 that I want to bring your awareness up. It's called Benfotiamine, okay? Benfotiamine is a type of B1 that is made fat soluble. It's a synthetic B1, which normally I never recommend, but this specific type of B1 is very beneficial and has the least amount of side effects, especially if taken with the whole B complex. But benfotiamine can reduce the damage from 250% to 400%. Then we have another nutrient, vitamin B3, which is called nicotinamide, okay? I'm going to put some links down below, but there are some studies that show that B3 can delay diabetes type 1 and prevent diabetes type 1, which is an autoimmune disease. So if I had actual diabetes, I would be taking benfotiamine and B3 on a regular basis. So if you wanted to prevent it and you didn't have diabetes, I think you'd be fine with the regular B1, but make sure it's natural. So now I put some links down below of what basic eating plan you need to be on if you have this, and that has to do with the combination of a ketogenic diet with intermittent fasting. But these are 2 other nutrients that I think are very beneficial if you already have insulin resistance, diabetes, or you're interested in preventing diabetes. So thanks for watching, and I will see you in the next video. Hey, if you're interested in finding out the underlying cause of your body issues, click the link below and take the evaluation quiz.